Alrighty, we'll go ahead and we'll kick things off. Hello, and welcome to today's webinar, One Change, Two Wins, How We Improve Both Margins and Patient Care and Respiratory Testing. My name is Samantha Burke, and I'm NERUCA's Administrative Director. And I'm so glad that you guys could join us here today. Now, before we get started, just a few quick housekeeping items to really help you make the most out of today's session. So just a quick reminder, this webinar is being recorded. And following this live session, you'll have the opportunity to access this recording on demand through Zoom, as well as on our YouTube channel. And then we'll have some time for Q&A at the end. So feel free to submit your questions at any point using the Q&A box at the bottom of your screen. Now, for those of you who may be new to us, NERUCA, we're in our 13th year of serving the urgent care community across the Northeast, and we really work together to strengthen and support the urgent care community by providing grassroots representation at the local level. We tackle legislative issues at the state level, and most recently, we've been working towards integrating urgent care into broader public health initiatives. And then, of course, today, we're delivering education and outreach to elevate the role of urgent care throughout the region. And so we really bring, this mission to life through engaging programming, including today's webinar and our annual conference. And in case you haven't heard, the news is out. Our annual conference will take place this year, Sunday, October 4th through Tuesday, October 6th at a new venue called Mohegan Sun in Connecticut. So stay tuned for more details. And lastly, before we get started, I would love to thank our corporate sponsors for their continuing support. Shout out to BD, BioReference, Extion, Fresh Paint, HealthTrack RX, Metropolitan Healthcare Billing Services, Midmark Corporation, Pfizer, Solve, Medline, and Healthium AI. And of course, a very special thank you to today's webinar sponsor, Aptitude. And with that, it is my distinct pleasure to introduce you to our speakers for today, Scott Ferguson and Kelsey Kirk. Go ahead and take it away.
Thank you so much, Samantha, for the introduction and for giving us the opportunity to present today on this important topic. So I'm Scott Ferguson, co-founder, CEO of Aptitude, and I'm joined with Kelsey Kirk, who's VP of Operations at Carolina Quick Care. So just say a few words to get us started. Here we are in the middle of respiratory season, and this is really urgent care's time to shine. And what you do during this season really does set the trajectory for the entire year. So I want to actually start with kind of an uncomfortable question. Like, what if the respiratory testing strategy you're using, the thing that you really rely on to drive your clinic's overall profit and patient satisfaction, what if that's actually lowering your profitability and potentially eroding patient trust? That's actually the case for most urgent cares. And the reason for that is over a decade, basically, urgent cares have been stuck with a trade-off of kind of cheap, fast antigen tests that are not very accurate and can miss a lot of cases, or expensive, complex molecular systems that are hard to run and can be pretty hard to justify. And so most clinics have all this time just been faced with those two options. The good news is that's no longer the case. There's now actually a third category of radically simplified molecular tests that can remove that trade-off between patient care and profitability. Basically, you can have both. And today, you're going to hear from someone who's already made that shift across her 40-site organization. I'm joined with Kelsey Kirk, who's the VP of Operations at Carolina Quick Care. And she is a real true leader in urgent care who's recognized this dilemma and solved it using the Metrics COVID flu test, which is Aptitude's next-gen molecular test. And she's seen a material impact on both the patient care and financial performance. And she's really here to share what she's learned so you could decide if those insights could help you too. And before we transition to Kelsey, I'd like to begin with just some background information to share about the importance and impact of the right respiratory testing strategy. And so to get started with that, I want to begin with also a harsh reality, which is the average net income for urgent cares right now is zero. And so what can we actually do about that? Well, many folks talk about strategies like adding patients or extending hours or adding new lines of service. We believe the problem can be much simpler. We believe that most urgent cares don't have an inherent profitability problem. They have a respiratory testing strategy problem. And you could solve it by leveraging the patient visits that you already have. And in order to do so, it first requires re-examining how you're testing. And so the trade-off that most urgent cares have been stuck between choosing uh, are these rapid antigen tests or traditional point of care molecular. And I think everyone in the audience has really confronted this dilemma already. You've got these cheap antigen tests that are fast and easy, but not accurate. And then we've got molecular that can maintain patient trust because it's got the quality of a lab-based test, but they're usually slower and a lot more expensive. And so I think everyone could agree that while molecular accuracy is better for the patients, and in fact, it reimburses better, generally because of the cost and complexity associated with it, most practices end up having to go with antigen. And so I think what's exciting about this moment is what if you didn't actually have to choose? What if you could make more money per test than antigen and deliver better care at the same time? Would this type of thing be able to move the needle on net income for the overall organization? And I think the answer to that question is yes. And the reason for that is respiratory testing is most urgent care's number one line of service. So a bad test choice is going to be felt across nearly half of your patients. And on the other hand, an improvement can be magnified across that massive part of your business too. And so my goal is to just show how to make more money and deliver better care by focusing up first on the revenue side. So this is, I think, a pretty obvious case. Your revenue depends on your payer contracts, and we've got two types. We've got the global rate contracts that are fixed fee per visit, and then you got your fee for service visits. And so there you get your E&M payments plus payments for your added procedures that you provide. And the good news is the majority of urgent care visits are fee for service visits. So I think nationally it's around 65%. And so when it comes to increasing revenue per visit, you want to generally run more medically justified services. So the more service that you provide, the more payment that you can generate. And to put it into perspective, like how much additional income you can generate by adding a test, we could look at adding a COVID flu antigen test. And so if you do this, you could add about another $70 to your E&M base rate for fee-for-service contracts. So that's a pretty meaningful boost. But then also adding molecular combo, you could add $143, which is more than double your E&M rate per visit. And what's also important to note is because you have so many of these visits, this could really begin to add up. And so you could see a significant increase in revenue by, performing medically justified tests for those respiratory patients. Now, in addition to looking at the revenue side, you also have to consider the cost. And so here I've tried to lay out the three major types that have existed. So you got your visual antigen tests. Those are generally pretty cheap, a few dollars. Then you've got your reader antigen. They're a little more expensive, like Sophia's around 20. And then you got traditional point of care molecular for COVID and flu. Generally, that's about $70. And so that's a pretty darn broad spread. So if you want to figure out, like you've got higher reimbursement for molecular, but also sometimes higher cost, what's actually the right choice? You got to really look at your payer mix to make the right choice. And so here we've tried to do some simple math. We laid out those three test types, the FlowFlex, Sophia, and Cephia there. And so we've got the average sales price, we got the CMS reimbursement, and then we can calculate the profit across 10,000 tests for each one of those. And what we can see is if 100% of your contracts are fee for service, and you're doing the same test for everyone, Cepheid would come out on top here. But as soon as you start incorporating your global rate population into your testing strategy, because you're not getting paid extra for those procedures you're doing for the global rates, it starts to erode the net income off of molecular. And so you can see here at 75% fee for service and below, the cheap antigen test starts to come out on top. And so, that's why generally so many urgent cares end up using these low-cost antigen tests. But as I mentioned, there's a new category that exists. And so it's this radically simplified molecular. And metrics is leading this category, and it can really solve this dilemma. So the metrics COVID flu product is the same type of high quality molecular test you get with a Cepheid, but it's faster. You can parallelize it as much as you want. They're very small, so you can get all the throughput that you need. And it doesn't require a contract. And also, it's priced accessibly to actually flip the economics in your favor. And so, what that can actually do is let you get both of those things, the better medicine part. So, this is a thousandfold more sensitive than antigen. So, you can avoid missing positives that are early in infection when they're really easy to miss. And that's also when treatments are most effective. And you don't have to deal with the serial testing requirements from FDA and so on for an antigen test. You don't have to do send outs. And you can avoid giving the patient the same thing they can get at the corner store for a couple of bucks. And what's also interesting is this can actually save the payer money in the long run too. And in fact, Davies showed a study in the Journal of Healthcare Economics that despite the higher per test cost of a molecular test, it can reduce the total cost of care for payers by about $260 per patient compared to antigen. And the reason for that is those errors that those antigen tests can make actually have an impact. So they can result in the requirement for additional confirmatory tests or incorrect or untimely treatments. And sometimes those can lead to hospitalization, which can really drive up costs. So molecular can really give you the better margins part or medicine part. And metrics can also facilitate better margins. And because of the price point that metrics is at, as well as its reimbursement, it doesn't matter what your fee-for-service rate is down to about 50%. It's always coming out on top compared to antigen. And so this type of category really can deliver on that promise of better medicine and better margins, all the way down to global rates that are about half. And so that can potentially impact a lot of urgent cares. But my goal isn't for you to have to take my word for it. I really want to share with you the story from Kelsey, who has made that switch. And so with that, I want to introduce Kelsey Kirk. As I mentioned at the start, she's the VP of Operations for Carolina Quick Care, 40-site urgent care spread across 4 different states. And so that's a very big lift that Kelsey has on her shoulders. And so, what's really impressed me about Kelsey is not that she's adopted this new test. It's like, if you think about everything that she has to manage between all the different demographics, the different payer contract compositions and the different organizations in her group, it's a lot. And with that weight, she's nevertheless recognized this like hidden operational and financial constraint in respiratory care that so many other operators kind of just accept as the way it is. And so, she really had the foresight to rethink that strategy and adopt it across all the clinics. And so it's just a very, very powerful leadership. And so I'm so thrilled to have Kelsey here. And she's who we're here to learn from. So with that, I'm going to stop sharing this so that we can bring Kelsey into the forefront, and and I'd love to start asking Kelsey some questions about her experience. So, hey, Kelsey, how you doing?
Hey, I'm doing great. How are you?
Doing great. So, yeah, I'd love to start by just learning a little more about and sharing with the audience a little more about who you are and why respiratory testing matters. And so maybe we could begin with you talking a little bit about your Carolina Quick Care and like how many sites you have, where you guys are located.
Yeah, so we have a little above 40 locations, currently still growing. We've got one opening in 2 weeks, so super excited about that. We operate across 4 different states, like you said. So we operate in Alabama, North Carolina, South Carolina, and Missouri. So yeah, molecular testing, the rapid has been great for us.
That's awesome. Cool. So yeah, so it's I probably wasn't under exaggerating when I was saying you had a lot on your shoulders. I think because so 40, how many is that? 43? Is that
Yes.
okay? And four different states. So I mean, it must be a pretty different composition between all your patient populations in those.
Oh yeah. Yes. Yeah. It's definitely a mix.
Uh-huh. And so for you and your goal and your role, are you're trying to provide sort of a uniform level of care across all of the organizations? Is that the right way to think about that?
Yes, yeah. So we definitely like our cookie cutter operations. If you walk into one of our urgent cares, you've walked into all of them. So we definitely want to make everything as streamlined as possible with the care that we give to our patients.
Right on. So what's your role? Maybe you can talk a little more about what it means to be VP of operations for an organization like
Yeah,
this.
so I oversee the clinical operations across all of our locations. Everything from staffing to workflow to testing new platforms and kind of setting how we're going to roll these new platforms or processes across all of our sites.
Okay. Right on. So then if you're evaluating different testing platforms and so on, so like respiratory must be a big part of what Carolina Quick Care is all about. Is that right?
Absolutely. I mean, it's a huge part of what we're about, especially during flu season, which I'm sure all of the urgent care operators on this call can agree. We get respiratory complaints walking through our door. I mean, they're probably the number one reason why they come through our doors.
Got it. Yeah. So that makes total sense. And so then I guess before metrics, what were you guys using for COVID and flu testing?
Yeah, so we were using the antigen, the lateral flows, visual reads, no analyzers. That's what we were currently doing, or what we were doing before metrics.
Okay, got it. So the ones that you just look at the result on.
Yeah,
Okay,
one line,
cool.
two line.
Yeah, yeah, yeah. Okay, right on. Right on. And so were there things that you liked about the antigen tests and things that you didn't like or
Yeah, so I mean, fast, easy to train on. However, we didn't like the unreliability of them, having those false negatives. It just wasn't something that we were great about.
okay, okay, yeah. So basically accuracy was kind of a concern for those tests.
Yeah,
Is that
definitely.
okay? And how would that play out in the clinic? Like if you had like a false negative or suspected false negative.
Yeah, so I mean, us and our providers, they knew the limitations. I mean, patients would ask, like, are you sure that it's negative? Because they're having classic signs of a flu. They're like, are you sure? And so the only other option we had was to send out a respiratory swab to Quest, which again
Hmm.
is going to take anywhere between 48 to 72 hours. By that point, they're probably feeling better. They've missed their window for any medications. And then they're going to get a separate bill from Quest.
Hmm. Okay, yeah. So that's kind of a double double whammy in
Yeah.
that instance. Yeah. Okay, got it. So yeah, so then I mean, did patients kind of like what was their expectation like coming to urgent care? Because like they could get these tests themselves. Like Joe Biden had been sending out some free tests back in the day of COVID and so on. Like what's their folks' expectation when they're coming into urgent care?
Yeah. I feel like when patients come in, they're expecting a higher quality of care. They're not expecting the same test that they can go buy from CVS. So it kind of just feels like you're kind of under delivering on that promise.
Yeah, got it. Yeah, totally. So it sounds like you truly were feeling that kind of tension of like, hey, we're patients are expecting a high level of service, and then like this accuracy business is kind of undermining that in some way.
Yeah,
Is that so?
absolutely. It's definitely one of those things that they expect, and then they're negative on the rapid antigen, and then we get their swab back and they were positive. I mean, it kind of have you lose that trust in the test that we're offering.
Yeah, yeah. So understanding that the accuracy was a issue, and like it's oh, my camera sounds like you also had awareness of did you have awareness of molecular options like while you were using the antigen test?
So we did have awareness. We had actually trialed Lucira before.
Uh-huh. Okay. And so that was like on the basis of like, could we give better care to patients, or was it driven by like the higher reimbursement, or what? I guess what was driving that?
Yeah, so both. I mean, we definitely
Mhm.
knew that we were leaving money on the table with not using the molecular testing because they do reimburse better. Um, and so that was kind of what led us to that is, we wanted a better option for our patients as well as, the reimbursement.
Right on. So you tried Lucira. How did that go? Was it
The,
did
I
it kind
mean,
of
the
deliver on those
concept was,
expectations?
yeah, it was promising. The concept was
Uh,
promising, but it
uh,
just didn't fit with us operationally. I mean, there was a lot to the setup
mm,
that we couldn't figure out how to place it in our fast-paced urgent cares, like we're high volume. So it wasn't operationally beneficial for us.
got it. Got it. Okay, so you saw the promise and like, hey,
Yeah,
maybe there could be some molecular solution that could help with the reimbursement and also the accuracy, but it didn't exactly pan out with
right.
this year. Okay. So then like how did you then come to learn about metrics and as an alternative?
Yes, so we actually heard about it through Urgent Care Connect at one of the conferences. So that's where we first heard about it. And then they came on site to kind of do a demo for us, show us how everything worked. So yeah.
Okay, cool. And so I guess so if I understand that right, so there was this concept that hey, molecular could potentially work in our situation if it fit kind of the operational constraints that were really necessary for this thing to work. And so then you tried metrics, folks came in, did a demo. Did that sh was it like an aha at that point, or was it uh, kind of were there certain things that were still unclear that needed to be
No, I think it was definitely like a aha. I mean, it was a lot simpler. The process, kind of learning how to do it was easy. It was easy to figure out how to have it within our, flow of our operations. Um, the
okay.
Yeah, it was simple. Cost was great. So,
Okay, so things that stood out for you. So it sounds like simplicity and the cost was an element. Is
yeah.
that
Yeah,
okay?
simplicity, cost, customer service, easy to read. The way the results are delivered to us is great. It's easy. All of our staff members can get a hand on it.
Okay, cool. So then there must have been like I can only imagine, right? Like with that large organization, you got all these different players and stakeholders involved. Like there must have been some skeptics on the team that were, worried about certain elements of a rollout. Like I guess did anyone voice some concerns about the idea of switching to
Yeah.
metric?
So I think one of the biggest concerns that we heard, of course, is the 20-minute runtime.
Mm,
And providers feeling like, oh, is this going to add on to our workflow? However, it doesn't. I mean, our rapid antigens are 15 minutes. And so it's just waiting five more. And plus, we were able to identify those patients, get those swabs going and ready. But providers didn't notice much of or any wait time longer than what they had previously.
okay, interesting. So that is the concern about the extra time, but it was more of a psychological concern. It sounds like
Yeah,
it didn't actually change the door-to-door time or the wait times for the providers. Is that
no,
what you're saying?
correct. Yeah, it did not change the door-to-door time.
Okay. All right. That's awesome. So that helped those guys basically see, okay, this isn't going to slow us down in any way. This can okay, that's awesome. So I guess going from going from that kind of initial like demo time to like actually rolling out in the clinics, that's a big lift too, right? So maybe you could just walk us through a little bit of what that looked like when you were trying to roll out into the
Yeah, so we started with a pilot at our busiest locations. We had
Mhm.
about a box of 25 to 50 tests at our busier locations. The team from Metrics came on site, kind of showed us how fast and efficient these can be ran. They helped with the training. It was easy to roll out. I mean, I'd say since we are 12-hour shifts, it'd probably take us about 3 to 4 days to get everyone comfortable with it within those locations.
Okay.
And I mean, the providers were happy because they were confident in the results. I mean, they saw the accuracy that we were getting during that pilot.
Hmm. Got it. So they were able to see that sort of clinical benefit
Yeah.
right away. And then you were saying like a few days to get like the team across different shifts all up and running proficiently. And
Yeah.
what was the learning curve like? Did people have big problems or was it fairly straightforward?
No, I think it was fairly straightforward. I mean, I didn't see any real learning curves. Yeah, they took to it very easily.
Cool. So yeah, that's awesome. So then I guess how did it fit into your workflow? So this was not disruptive. This didn't like change, like you didn't have to like retrain the workflow for people, or it just slid
No,
in. What was it?
no, it just slid in. I mean, it didn't change anything at all. Our medical assistants ask patients as far as their symptoms. They go ahead and get the swabs going, and then they go back in to finish their triage. So the test is available by the time the provider's ready to see that patient.
Okay, cool. So was there anything that kind of surprised you once you started using the test?
Honestly, I think it's how easy it was used. And using the Luceras previously, trying those out, this was just a lot easier. The readers are smaller, so again, they don't take up room at all. Room at all. And then the color-coded results. I mean, I feel confident and the staff feel confident as far as reading those results. They're clear.
Okay, right on. So in the busy time, you've got this, an unambiguous outcome that everyone can recognize. Okay, that's cool. So then, yeah, again, I think from my understanding, like you guys are doing something that's very, very, you know, it's simple, but it's also like a bold move, right? You're you're rolling this test out across all of your sites in the different states. Um, what were your considerations for that? Because that's also a really big lift too, right?
Yeah, yeah, it definitely is. And so our consideration was again, we want to have that promise of all of our locations operate the same. We
Hmm.
want to give that patient care and these better testing to all of our patients, no matter what state we're in. So,
Okay, that's awesome. So that's kind of the driving force is
yeah,
like high quality right from the outset. So you guys are using this as first line testing
yeah,
for all the patients.
we are. Yes.
Okay, that's awesome. And so, okay, so I can imagine that also can simplify things operationally because everyone knows like, okay, this is what we got to do. It's uniform across the all the sites. And then from a patient standpoint, that sounds cool too because they can, get uniformity of care across all your sites too and elevate the brand and expectations. I guess financially, like um, what was the impact like? Because that's a big move, right? Putting it across all patients, all sites.
Yeah, definitely. So when we look specifically at respiratory visits,
Mhm.
and moving to metrics, it improved our net revenue per visit. So it reduced the friction in care delivery, but the impact wasn't just clinical. Um, we don't typically think about it as profit per test because reimbursement and pricing vary widely by payer and contract. But for us, it was clearly financially better and sustainable. So,
Okay. That's awesome. And like, was this a pretty significant change, like financially, like, yeah, I guess, yeah, if you think about different types of initiatives that you could do, like, did this one have a good ROI in that
Yeah.
way?
Yes, it did. It did. Yeah.
Okay. Awesome. So significant financial benefit too. That's great. So how about the patient experience itself? Like, w patients are responding differently to the product,
Yeah.
or
So I mean, they're more confident in their results. They are happy that they're not getting a separate bill from Quest. We don't really have any more of those like, are you sure moments? Um, so yeah, they definitely are happy. I'd say they're probably most happy with the fact they're not getting a separate bill.
right on. Yeah, that makes total sense. And then how about so the providers themselves, are they another staff member? How do they feel? Are they
Yeah, our
happy with the transition?
yeah, our providers are happy with it. They feel confident in the results that they're giving. They're not having to second guess. They're not having to have that awkward conversation of like, well, we could send this out just to be sure. Um, and the staff, it's just a natural part of their workflow now. I mean, again, they're easy to run and easy to read, and they just fit right in. And they took to it very easily.
Cool. Cool. So that's awesome. So I guess just a follow-up question on that. If so because you're doing this as first line testing, patients don't have to think, or sorry, providers don't have to think about like, which specific thing should I use? I can use the good thing right from the outset for everyone. So there's it sounds like operational simplicity that comes from that. Okay. And so even though you guys have global rate patients, the math still works out so that this comes out as as a net improvement in financially for you guys too.
Correct. Yes.
Okay, awesome, great. So then this type of model, like you had that previous vision, like it would be great if we could switch to molecular. The reimbursement's better, the outcomes are better for the patients, but like we haven't been able to find a good solution for it. Sounds like Metrics is a good solution for you guys, and it's working out. Like, would does this have any impact on how you think about testing for other conditions in your clinics as well?
Definitely. I mean, it's definitely opened our eyes to what could be possible. When you see just how simple and effective this can be for respiratory, you do start thinking like, what else? What else can be improved? What else can have a similar approach? So you definitely open your eyes.
Okay, good stuff. Well, we're working on those too, so there's more coming. That's awesome. So I guess if I understand the total experience, like you were facing that dilemma at the start, right? Between this limited quality of care with the antigen tests and feeling that there was some money on the table. And it sounds like Metrics is able to address both of those things while also being uh, relatively easy to onboard and run with the staff. So would you, I mean, based on these experience, would you recommend Metrics to other urgent care operators?
Yeah, absolutely.
Okay. Right on. Well, how about, I mean, everyone's situation is different, right? And so yours is interesting because, you have this span across, in fact, yours is hard, right? Because you got to make it work across this, disparate setup. So I guess, would you give any advice to somebody who like is facing this like similar type of dilemma? Like those parts don't sound unique, right? Like everyone has this trade-off between like, the performance of these things is not that good, and we want to but like, do you have any advice that you could give for someone who hasn't made a switch like this yet?
Yeah, I mean, I believe that you're leaving money on the table if you're still doing antigens. And also your patients deserve better. They deserve that accuracy that comes with this type of testing. And the switch is easier than you think. It's simple. The training takes days, not weeks. And again, you'll definitely start seeing the financial impact right away. So I don't see why there's any reason not to explore the option.
Okay, right on. And so for folks that are, and you touched on it, it sounds like the transition is easy, but I guess, when everyone's busy, right? So it's hard to, it's hard to, combat the day to day and do something new sometimes. And so I guess folks that may still be worried about trying to make a switch like this, what should they think about, or what would you say to those guys?
So I would say it will fit into that flow. I don't see there being any issues, and there wasn't any issues as far as changing up the style of testing that you're doing. Um, and I mean, try the pilot, do the pilot, see the reimbursement difference yourself, and see how simple it can fit into your workflow.
Fantastic. Okay, yeah, that's great advice, and maybe that's perfect advice to wrap up this part of the webinar. And maybe I've asked you so many questions already. I'd love to open it up to the attendees for questions as well. Would you be open to that, Kelsey?
Yeah, of course.
Okay, sounds good. Well, then maybe we can hand it back to Samantha to get us going with the Q&A.
Hey. Alrighty, thanks so much. So, thank you so much, Scott and Kelsey, for that lively discussion. We're going to go ahead and open it up now for Q&A. As a reminder, feel free to drop any questions that you have in that Q&A chat box at the bottom of your screen. There should be two of them. There's a chat and then there's a Q&A section. If you could just drop in the Q&A section, we'll start reading some of those questions coming in. So, let me see. We're seeing some questions already coming in. Alrighty, so first question reads, how many tests do you do on your busiest day?
So busiest day is one of our busier locations that can see upward to 80 to 90 patients. We will probably do 45 to 50 tests in a day.
And how does it hold up during, peak volume days when you're seeing back-to-back respiratory patients?
Yeah, it holds up really well. Like I mentioned earlier, I mean, it fits into our flow. So we're getting those tests and getting those ran before we start the full triage. And that has helped us a lot. I mean, the results are ready for the provider whenever they go in the room.
Great. Thanks so much. Okay, let's see here. I'm seeing a couple other ones come in. Alrighty, so one person says, I've got a two-part question. So first one reads, do you test every respiratory patient using metrics with the same standing order? And then the second part, I'll read it. Happy to repeat it though. If so, you are losing money on global rate patients. I understand that you're still able to come up ahead because of your fee-for-service contracts pay very well. I'm just wondering if you've considered only providing metrics to the fee-for-service patients and antigen tests for global rate patients.
Okay. So for the first question, yes, we're testing all of our patients based off of the same standing orders with the metrics testing. We don't look at it as if we're losing money on our fee for service contract. As I mentioned earlier, I mean, our net per visit has went up in general across the board. So
Great, thank you. Another one reads, you mentioned you tried another molecular platform before. What made you confident enough to try again with metrics, even though you had problems in the past?
I think it was the conversations and the willingness to come on site, show us the pilot, I mean, I feel like they had something to prove. They were like, no, we're going to show you that this will work. And so that was great.
Right on. I just wanted to quickly jump in on that too. Thanks for mentioning that, Kelsey. And I wanted to say we really believe in the potential benefit of this product, and what we did for Kelsey, i.e., provide a free trial so that she could see the impacts directly. We are offering that for other urgent cares as well. And I actually put a little link here. You could scan it if you want to sign up for a trial, and you can also contact us at our contact there as well. But we are trying to provide that so folks can see firsthand in their own situation as well what how the how both the operational and financial aspects actually play out.
Great. Alrighty, another question's coming in saying, when you switch from antigen to molecular billing codes, did you run into any claim rejections or denials from payers? And how did you handle that across 4 states with different contracts?
Yeah, we did at first. However, it was pretty simple. I mean, one of the things I suggest to everybody is to have your symptom diagnosis. Add in as many symptom diagnoses that you can, and that has corrected our problems.
Thanks so much for sharing. And has having better test results changed how often you need to send patients out for follow-up labs?
Yes, we haven't had to.
Oh, wow. Alrighty, we've got one more question coming in. This one came in just a moment ago. It reads, does the result print? How long does it take to run the test? How often is FFS or FFS insurance not paying it and applying it to patient deductible? And does that lead to disgruntled patients?
I could hey Kelsey, do you want me to answer the first
Yeah,
two parts of the question, and
Yeah,
then
that'd be great.
you can do the last one? Okay, cool. So yeah, does it print results? So we have two forms of the product. So one of them can print, the other one does not. So we have our small reader, which is this little unit here. This, you just get the results straight off of the lights. So sorry, let me put this in front of my camera. So you don't actually see this doesn't print. We also have another version of the product called the metric station that connects to sort of a digital interface. There is a printout. It can connect to EHR as well. So that's another option that exists for customers if they require those features. And the second question, what was it? The time to result? Is that what it was?
How often is FFS insurance not paying it and applying it to patient deductible? And yeah, and
Oh,
how
okay.
long to run the test?
Oh yeah, the test is 20 minutes for the COVID flu test. And then Kelsey, did you want to comment on the last part of that
Yeah.
question?
So we were applying it to the patient's deductible. So we do see that, especially with those higher deductible rates, but we haven't had any upset patients regarding it. I think because our old model, we would send them off to Quest and they would get that bill from Quest. It's cheaper getting the added molecular test from us than it is from Quest. So we haven't had anybody upset with any of their bills.
Yeah.
Great, thanks so much. We'll give it another moment or two and see if a couple more questions come in. Have some good questions here today.
Yeah, these are good questions.
Alrighty, we'll give it just a couple more seconds. And no worries at all because if you didn't have an opportunity to ask a question or if something comes to mind later, we're always happy to continue the conversation. So we'll go ahead and we'll wrap it up. But if we see any questions come in, I'll pause and I'll give us a moment to address them. But if something does come to mind later, please don't hesitate to reach out to us. Always feel free to email us at admin@neruca.org, and we're happy to continue the conversation. So just, yeah,
One thing, Samantha, I also put our
absolutely.
info at aptitudemedical.com. Feel free to, if you have any questions for us specifically, feel free to reach out to us there as well. We're happy to engage and answer any questions that you've got. We're always available.
Perfect. So you've got a couple different contacts, point of contacts if you need them. And thank you so much, Scott and Kelsey, during today's presentation. Thank you so much for partnering with us on such an important topic in urgent care medicine. It's been an absolute pleasure chatting with both of you today. And to all of our attendees, thank you so much for your time and attention during today's webinar. We hope that you found the session insightful and valuable. The recording from today's webinar will be available on our YouTube channel in the coming days. And again, we really appreciate your participation and we look forward to seeing you at our next session. So have a great day, everyone. Thanks so
Thank
much.
you,
Thank
Samantha.
you,
Thanks,
guys.
Kelsey.
Thank you, Scott. Thanks, Kelsey.